Hi everyone, welcome to Question AI video. 5. Hyperactive bowel sounds in one quadrant and absent bowel sounds in other quadrants plus nausea and vomiting may indicate 1. Pancreatitis 2. Cholecystitis 3. Gastrointestinal bleeding 4. Intestinal obstruction 6. Diarrhea. Ang mahovergersistic curry or alinitivi or mimbiri 4. Intestinal obstruction 6. Your patient is receiving an IV of DAS 1000 milliliters, ordered to run at 150 milliliters per hour. The IV tubing delivers 15 drops per milliliter. You would set the IV to run at blank drops per minute. 7. Your patient is to have a liver biopsy. What teaching point or points? Want the full explanation? Check out the details below for the complete answer.